It's an honor to be able to introduce to you Dr. Wendy Book. Dr. Book is actually a very unique kind of doctor. I didn't even know that this kind of doctor existed until I met her. She's an adult cardiologist that takes care of patients with congenital heart disease. It sounds like the success of our pediatric cardiologists has led to a whole new field. And she's one of the leaders in the field and is located in Atlanta at Emory. Wendy is also the president of APFED, the National Advocacy Organization for eosinophilic disorders. She has a very personal connection to the disease, and I'm going to let her talk about that. So it's a pleasure to have Wendy at the summit this evening. Thank you.
Thank you. It's an honor to be invited here to speak among such distinguished company. Thank you for inviting me here today. As Dr. Arnav said, I'm a cardiologist by day and patient advocate by night. And I'm going to share a little bit about the patient advocacy point of view of eosinophilic esophagitis and take you on a trip down memory lane over the past 10 years since APFED was founded. The first decade of APFED's existence, I think, can be split into 3 phases. The first being the non-believers phase, second, the enlightenment, and third, building a better future together. We've reached the 3rd phase pretty quickly. That's my son, Ryan. He is now 12 years old, and you wouldn't know him from any other kid out there. But things didn't start out that way. When he was born, he had trouble very early on. Failure to thrive, vomiting, the usual eosinophilic esophagitis symptoms, except the year was 2000, and no one had heard of this disease in that year. He was hospitalized for his first birthday, NG tube was placed, and we were sent home with no diagnosis, a kid who was still vomiting, very lethargic, and still no answers. We literally took him to dozens and dozens and dozens of doctors. He had an endoscopy that first year with a biopsy, and in retrospect, it was clear what the diagnosis was, but at the time, nobody knew. They hadn't seen it. We ended up in Cincinnati for the wrong reasons, but it was the right place. He went up there to see a motility specialist who took one look at him and said, "I know what this is." It was the first time we had heard that. My husband and I looked at each other and said, wow, here we are, 2 physicians, and we couldn't help our own child, 2.5 years to get a diagnosis. How does anyone do this who doesn't have that background? How do they navigate the medical system in this situation? And we got very involved after that, trying to spread awareness, educate on many, many levels. At the same time that we were going through our early trials and tribulations with this disease, there were a number of other families across the country dealing with the same thing. And this is Beth Mays. This is her son, Charlie. Beth is one of APFED's founders. And her story was just like ours. When we met and talked on the phone, it was, wow, you went through the same exact thing we did. And there were several other mothers who were in the same boat. Charlie had gotten so sick he was hospitalized on TPN before his diagnosis was made. And what we found in those early days is this disease doesn't exist. We came back to Atlanta with a diagnosis of eosinophilic esophagitis and heard, no, it's just reflux. It's just reflux. There wasn't any good way to distinguish the two then. There were no diagnostic criteria. It was a controversial thing at the time. Now, it seems pretty obvious, but back then it wasn't so. So Beth, Jackie Fanning, Sherry Herrick, all sharing same stories, got together and they founded APFED back then. $500 check from Beth's grandmother, 3 moms sitting around a table. Never tell moms they can't do something. That's just the most tenacious group out there protecting their young cubs. And the doctors were very involved early on. There were a few centers around the country. Dr. Phil Putnam, who's here with my son Ryan in this picture, was very involved early on. Glenn Ferruta, Chris Leocoris, Barry Werschel, all of them are still involved today. And they saw the issue, they knew this existed, and they knew there was a need to improve on the status quo. Well, APFED's motto has always been, it's about the patient, it's for the patient. And Families, patients come first. One of our earliest efforts was educating the patients so that they could be empowered to take control of their health care. How do you find the right physician to deal with this disease? What are the treatment options? I learned a lot from the other families very early on, simple things that no one tells you in the doctor's office, like how to prevent your feeding tube disconnecting from the extension set and feeding the bed, these kind of things that you just don't learn in the doctor's office. So APFED set forth understanding that to move forward, we needed a foundation of education and awareness. There were a number of things that had to happen before research could be successful. And APFED went about educating on a variety of levels: public, patients, families, physicians, everything. Beth, very tough young woman, would go out to those medical conferences and stand in the hallway and tell the docs, you got to know about this disease, you got to learn about it, you got to learn about it, got to learn about it. And those same doctors who said, we don't believe this exists, within a couple of years came back to her and said, you know what, boy, does this exist, and I'm seeing a lot of it, I'm seeing more of it. And many of those doctors are actually now local experts or regional experts on the disease process. Raising awareness on the federal level within the government was important as well. And in 2007, Beth and I sat down and co-authored House Resolution 296. When I went to medical school, if you asked me, would you be writing a bill later in life, I would say no. But here I am, and we did it. And with the help of Congressman Larson from Connecticut at the time, this passed in a record 3 weeks, forever marking third week of May, National Eosinophil Awareness Week. This little girl here, Jessica Seidel and her mom. This is Nancy Pelosi. This is my son, husband. Kids are there with their backpacks and feeding tubes, and Jessica had the opportunity to speak on the House floor. That was the beginning. We sat down with our medical advisors who've been a very, very important part of APFED from the beginning. Dr. Anav is one of our medical advisors now, and he will tell you it's not a cush job. They work. And they get very little back in return, but they work, and we appreciate it. We sat down with the docs and said, we got to have diagnostic criteria. We can't expect to educate people without telling them what the disease is and how to diagnose it. And Glenn Ferruta and docs got together, and the first International Gastrointestinal Eosinophilic Research Symposium was founded. And they've had several meetings since, and now we have consensus recommendations on diagnosis and treatment. And the effort now is to spread that word. The docs sat down with us and said, we need ICD-9 codes for these diseases. How can we track people? How can we get insurance coverage if we don't have ICD-9 codes for the disease? So we sat down and we started writing justification for new codes in 2005. Also a new experience for me. I've learned a lot over the years. And we presented these to CMS, and they were approved and took effect in October. So if you don't use the codes, use the codes, please. They're there for you. They're there so we can track these patients. EOE is 530.13, and these will translate into ICD-10 as well. In addition, we are very involved on a national level and a number of organizations. So going forward, there's still a need for better treatments and better diagnostic testing. So we continue our efforts on the Hill on a regular basis, educating legislators about what the needs are. There's been report language recently included in the Senate Appropriations Bill that is urging further research on these diseases. Research right now is funded by these people. This is a walk that was held in Philadelphia. This group, this is from 2006. Some of these people are very much involved with today's Washington Area Eosinophilic Connection Group, and they've continued on in that fundraising for research for these diseases. We've awarded nearly $1 million in research grants, and that money has come from the hard work of families affected by these diseases. They've gone out there, held bake sales, car washes. $1 million, we realize, is a small amount in the research world, but when you think about how it was raised, it's a huge amount of money. And we look forward to continuing on and increasing that amount over time. What do the patients want? Well, patients want to be just like everybody else. These kids want to go to school and run around and play sports and do everything that everybody else does. And many of them are able to do that, but some cannot. Their lives are interrupted by endoscopies, lots of them. My son is 12, he's had 16 endoscopies. The only reason he hasn't had more is Mom put the brakes on. But this is the reality for them, endoscopy after endoscopy. It seems simple on one side of that bed, but on the other side, this is a very stressful time for the patients and their family, very stressful time for the children. It's invasive. The anesthetic is not without consequences. So less invasive tests are needed to manage this disease. It's managed by biopsy now. Treatments. We need some treatments. This is a fairly recent survey. Despite literature showing how effective current therapies are for eosinophilic esophagitis, nearly a quarter of people still have symptoms 3 years on treatment. So those results are not necessarily translating into improved symptoms for the patient. And these are symptoms. We're not talking about active disease, but symptoms. And those treatment options need to balance quality of life. Some patients do very, very well on restricted diets and elemental formulas. My son is one of them. He was never bothered by it, never bothered by the stares in the classroom. He'd stare right back. He did his feeds in the classroom. Never afraid to show his G-tube to anyone. For other kids, it's traumatic. They don't want to do it. My son still follows a very restricted diet. It doesn't really faze him, but it's not right for every family. Not everyone can do that. This is breakfast for many of these kids, medicines, elemental formula, day in, day out. From the patient perspective going forward, the greatest needs are finding other ways to diagnose and manage the disease, develop that less invasive testing, and treatment options and things that take into account quality of life. The psychosocial consequences of this disease should not be underestimated. So going forward, we're going to continue on with education and awareness efforts on all levels. Support is a huge part of what we do. I can tell you as a mother of a child with eosinophilic esophagitis, nothing is more gratifying than going to a conference and sitting at a table with a bunch of parents who really see how funny it is that your kid puked at a fancy restaurant in a bread basket. These kind of things just are not appreciated unless you live it every day. And we time ourselves. How fast can you get the plastic bag out? Very fast, very, very fast. The day that we were able to go out without a change of clothes was a huge celebration in our house. We're going out and we don't have a bag with us. This is really exciting stuff. So this support is very important for these families as they deal with this. I want to thank you all for your attention, and going forward, we're going to continue our efforts. We look forward to the day that we're not needed anymore, the day that we can say, we're done. We've done everything we set out to do. Disease is cured. We're moving on. Thank you.